Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I awoke to snow and icicles on my tree, which is not typical for Baton Rouge, Louisiana. So it was very interesting to wake up to the little ping, ping, ping of ice bouncing off of my bedroom window. But Faith and I are safe and sound and warm in our home and hope that we won't lose electricity like some of our neighbors have lost their electricity. We've seen pictures on Facebook of our HAFA members in Texas who also got several inches of snow. I wanted to give you an update that Faith is doing wonderful with her ACL surgery. She has about 20 stitches, but seems to be healing wonderful. Just having to keep her quiet in one room and not allowed to walk around except to go outside to potty. So if you're curious about our spokesgirl, she's doing good. I wanted to give you some updates today. First of all, Medicare buy-in. There's an article in your Monday news that they are saying a Medicare buy-in could cut national spending and consumer cost. That's the conclusion of the Urban Institute, a Washington, D.C. think tank. They are referencing two bills, the Medicare 50 Act, Senate Bill 470, and the Medicare Buy-in and Healthcare Stabilization Act, H.R. 1346. So we want to keep our eye out on those two bills. HAFA does have a white paper on several of these issues, and our legislative team is working on upgrading and creating new white papers that will be used on Hill visits as soon as we can get to Washington. From what we have, but from what we can tell, we do not foresee a change this year on Medicare for all or a Medicare buy-in or a single payer because of the slim margin in the Senate. However, you never know, so we want to be prepared for what could happen and have some, steps on what HAFA would do going forward. Also, prescription drug prices in the U.S. are more than 2.5 times higher than any other countries. I think us working in this industry, we absolutely know and have run into that. The RAND org says that it's more than 32 other countries. I personally have had a conversation with pharma on exactly why our prices are higher, and they point to R&D, and then if you say, well, most universities say they handle the R&D that you don't, then the finger points another way. So we know that's a problem. We know that that President Trump has tried to address it. We understand that President Biden is going to continue to try to address it. So we will see going forward how that works and how that affects our clients. We've talked about this before. The surprise billing is in the Consolidated Appropriations Act of 2021, the budget, the stimulus bill, whatever people are pointing to and calling it, that's included. And I wanted to point out a couple of things about that. The law does go into effect next January. It addresses emergency care, air ambulance, which was a question in our recent legislative call, and treatment by an out-of-network provider while at a in-network hospital. And we all know how balance billing happens, and the person goes to an in-network hospital, they think they're doing the right thing, and they get a bill that they didn't know that an out-of-network anesthesiologist, radiologist, pathologist was involved in their care. This bill or this law, I'm sorry, I'm not going to call it a bill. This law calls for arbitration. It's an arbitration process between providers and health plans. We had a recent call with Angie Sura on a deep dive into this law, and the Blue Cross Blue Shield of Louisiana's economist pointed to New Jersey that they have arbitration type process of balance billing, and their charges are that the bill that charges that the arbitration says that that you have to pay is 9 times higher. I'm going to apologize and stop right this second. You probably can see that my eyes are very puffy. For some reason, I still have a cold that is settling in my eyes, and having a little bit of trouble reading my notes, so I apologize. I'm going to apologize straight up. It's crazy. I know it's the weather. 1 minute in Louisiana it's 70, and today it's in Baton Rouge it's 18. So I'm going to point to the weather and apologize. The law also has protections to discourage frivolous arbitration. I think it's also has attacked my lips. Not only my eyes to see, but my lips to talk. The bill goes into effect January 1st, 2022. Rules, of course, are being developed, and we'll see some of those rules come out and figure out exactly how this is going to work. And hopefully, fingers crossed, that it doesn't increase cost anymore. Our insurance premiums are skyrocketed out of the roof, out of control as it is, and to add anything to it, it's just something that's not going to be affordable. Also wanted to point out that there is talk in the, I believe it's the Ways and Means in Washington about giving some tax credits to those over 400% of poverty, giving more tax credits to those under 400% of poverty, and also paying for COBRA. So watch for that. As soon as we learn more about it, we'll give you more information. There is a $150 million lawsuit in Florida for groups misleading ACL insurance policies. So what they're doing is selling limited benefit indemnity plans. This is something that we talked about in our legislative call in the last couple of weeks, and the fact that HAFA needed to create a white paper that talked about how insurance agents needed to be transparent, and if they sell these type plans. And of course, we believe that everybody should be introduced to all options. But if you are going to introduce someone to these options, that you need to be very transparent and explain exactly how these plans work, and let your potential client know what they're buying, and possibly have them sign off on information showing that they understand what they purchased. If that is something you would like to be a part of, please reach out and let me know, because we will be putting together a team to work on that white paper. The other thing is the EEOC issued proposed regulations and employer wellness programs. That's the Equal Employment Opportunity Commissions. There is a article by the Wagner law firm. So please take a look at that and read about the wellness programs. Also wanted to let you, reiterate the fact that HAFA's Agent Summit is August 26th, 27th. Our plan is to have it at the Nottoway Plantation in White Castle, Louisiana, to allow us an opportunity to meet, to social distance, to have a program where we're not intermingling with other people in possibly downtown New Orleans or another large city, that we would be able to have a whole plantation to ourselves. We have done a survey. Thank you big time to Tori Freeman, who is a marketing genius. You should have received that in your inbox. Please respond. Let us know. We're trying to get a head count on how many rooms we could possibly need. The Nottoway Plantation has 40. So we're hoping that that could accommodate our membership, not only our membership, but also our sponsors. It's kind of hard to look at yourself with puffy eyes and wonder, like, my eyes are tiny as it is without them being puffy and affecting my eyesight. But we will be looking for speakers. So if you have an outstanding speaker that you know of, that you've heard speak before, that you think could bring some value to HAFA's summit, please let me know. If you know a sponsor that would be wonderful for HAFA in 2021, please let me know. I can send you a sponsorship packet that you can share with anyone. Please reach out. Please go to the website under HAFA Resource Library. There are so many good articles. Role of an agent. Our white paper on single payer. There's all kind of stuff about HAFA. If you're trying to introduce a colleague to HAFA, we encourage you to let your colleagues know about us. The bigger we are, then the more bang we can have on Capitol Hill. Remember to give to the PAC. That's an important part of the PAC. We will be looking for folks to sit on our PAC committee. So if you want to give to the PAC and you want to be part of that discussion on who we give money to, whether it be HAFA PAC Louisiana or HAFA PAC Federal, please, we'd like to encourage you, to, join the committee. It doesn't take any prior, experience. You can be on any level, congressional, senatorial, or presidential. Just you have to be someone who gives to the PAC. I wanted to also reach out and ask for any legislative liaisons. That is someone that we ask for at least one volunteer in each state, can be more, just to let us know what's going on in your state. Did you hear a bill that we should be concerned about? Did you hear a bill that we should support? So we can connect with our legislative team and connect with those folks that are giving reports and letting HAFA know what we need to do and what we need to know. Just a shout out, your legislative vice chair is Derek Babcock. Your regulation vice chair is Jennifer Jennifer Lovett. You can tell the cold brain. Jennifer Lovett from Connecticut, and Bridget Gilbert. Great team. Last week, I also listened to a CMS communications update, and there's a couple of things that I want to talk to you about. The SEP starts today, February 15th through May 15th. Couple of things. You enroll someone today, it goes into effect March 1st, sorry. You enroll somebody March 31st, it goes into effect April 1st. So it's always the first of the month following the date that you enroll them. So it's an SEP, it's not an open enrollment, it's an SEP. You can make any changes that you need to make for an individual client, or you can enroll anyone that you would like to enroll. What we found out this morning is that in order to change a plan, you must state that it is an SEP, and you must say that they don't have coverage. That's kind of the glitches that we've figured out this morning that could change. If you have any problems or questions as you're trying to enroll someone or make a change, just send me an email. We'll work through it. That's just something that we discussed this morning that we think helps get to the point where you can choose a new plan. Don't expect it not to have bumps. It's going to have bumps. Everything does have bumps. But this is an opportunity, hopefully, for you guys to sell some new insurance and help some folks change to a new plan should they need to in this early part of the year. But remember, you always know that I tell you, if you change plans or make any changes to their income, that could very well change their deductible, their co-insurance, and their deductible and co-insurance will start over. So make sure you are very transparent about how this is going to affect their bottom line. But my communications webinar from last week, a couple of things. They are going to spend $50 million on outreach, TV and social media. They're going to go to certain cities and have some targets on this Hispanic population. There's going to be a lot of TV ads and things like that. And what I'd like to point out is that these ads are going to send people to healthcare.gov. Now, we can only hope that they go to healthcare.gov and they choose that they need an agent, and we received notifications through Help on Demand. But you need to make sure that you are out there doing your own. Not everybody can afford TV ads, but social media is free. Let everybody know that they can call you directly. I'm doing social media ads saying go to our website, click on find an agent, go to your state, go to your city, and use one of our HAFA agents. So make sure you're doing that for yourself, because the ads will send them to healthcare.gov, which will circumvent and not send them to the agent broker community. The other thing is, if they have an email on anybody, they're going to send them 2 emails a week during open enrollment, and the last week once a day. Now, what does that do? I've complained about it for the last, God knows, when it was signed, 2010, but it's probably 2011, when I started complaining about the communications problem. Your clients, potential clients, are going to receive emails. It might be, did you pick a plan, pay your premium, whatever. They could have already picked a plan. They could have already paid their premium. What does that do? It confuses them. What does that do? It makes them call you, or if they pick a plan they shouldn't have picked because they didn't realize that you did that. So be very aware. Make sure that you tell your clients, potential clients, do not call do not call the marketplace. Do not go to healthcare.gov, that you are happy to help them through this process. I kind of foresee, if they spend as much money as they say on these TV and social media ads, that it could very well cause the consumers that we help some confusion. So please, please, please tell everyone, help me, promote, call your local agent. Do not call the federal government. They're not, they do absolutely run healthcare.gov, but they are not, an agent and broker. And also, please have them not call the navigators, which are not licensed agents, nor do they carry E&O or anything else, or required to take the education that we are through our licensing process in each state. So no navigator, no healthcare.gov. I think that might be it. Please, even though I'm suffering from puffy eye, I am still working. It's not affecting the HAFA office. So call me if I can help in any way whatsoever. Have a wonderful week. If you're not used to the snow and ice like we are, and we're required to stay off the roads, stay off the roads. Look out your windows. Still work, but be careful. Louisiana, Texas, we're not used to this crazy weather. I did tell our HAFA New York agents I'd love to look out the window and see snow, and they're like, well, what happens when there's no electricity and you're freezing? Okay, I get y'all. I understand what you're saying, but it is pretty to look out the back window and see the icicles hanging off my tree. But have a wonderful, wonderful week. Until next Monday, Ronell Nolan, proud and honored to represent the HAFA Freedom Fighters, the best of the best, the cream of the crop.